Hi, I'm Dr. Robert Dean. Hip replacement surgery is a large surgery done inside of a hospital with recovery, rehabilitation, wound healing, and all the above. So you should be aware of this, especially if your surgeon doesn't give you all the details prior to having the surgery. One of the most important parts of hip replacement surgery, rehab, is stretching and strengthening those muscles around the hip joint so that you have proper motion and proper strength so that you can resume your natural gait or how you walk, because this will affect your back, your knees, your hips, everything else. So remember, hip replacement surgery is a very large surgery that is done in a hospital. Here at ARO, we actually have minimally invasive alternatives to that will get you up and moving within a day or two with very, very little downtime as far as recovery. To schedule a consult, feel free to give us a call or email us at ARO.